Welcome to today's podcast with Winning with Grace. Today we have Dr. Shahad with me, and he and I actually met because I went to a chiropractic and he became my chiropractor for a little bit, but just a little bit of backstory about him. He's born and raised in Iran and actually moved to Texas in the seventh grade. He moved to Houston, then he moved to Dallas, and then he was able to go to school at UTD, study there. After that, he was able to go to his chiropractic school, which was Southern California University, right? Southern
Yep.
California University. Then he was able to go back to Iran, practice his chiropractic work, and then he decided right before 2020 to move back to Dallas, start his business. And he found out really quick he was more of a Cali boy, and then decided to go out to LA and actually really blow up his business. But I'm really excited to get to talk to you today. I've obviously learned a lot from you. You were the first chiropractor that ever taught me anything about chiropractic, because I would come in and see you for like some neck pain, and you were like, try these exercises. I don't want to see you a lot. Like, I want you to be able to fix your body so that we don't have to keep coming in, and it's more of a maintenance thing than it is a preventative thing than it is a let me fix your body because you just can't function. And I really appreciated that about you. And then we've been able to do a few different sessions with different techniques. And one of the coolest things that I've watched you do since I've known you is become a practitioner of the ring dinger, which is a special technique in chiropractic, which I know is like really few and far between chiropractors actually get certified to be able to teach this. And so I'm really excited to dive into just like your expertise and your wealth of knowledge when it comes to this field.
Let's do it. Thank you for having me. And it's good to see you as well. So I'm excited. Let's dive in. Let's get to it.
Tell me a little bit about your backstory and how you even ended up in chiropractics. Like, what was the initial draw to it? Because you have to be like obsessed with this kind of at this point now.
So the story kind of begins with after graduating from undergrad, I wanted to explore around. At the time, I was actually working at an optometrist office as an optician. I wanted something that had to do with health and also be able to own and operate a business. So, I was like, oh, this is cool. We can sell eyeglasses and contacts and stuff like that. But, quickly I realized that I don't want to be just focusing on the eye itself. I wanted a bit more of a holistic approach and wanted to be able to look at the whole body and how it's functioning and how everything is, working together. So, from there, I had a couple of friends. One of them was a podiatrist, and he told me, he's like, come to my surgery center. He's like, if you want to get into med school, I'll be happy to write you a recommendation letter. I went into his surgery center, and just the vibe, the smell of the surgery and looking at blood, and I was like, this is not not for me. I want a
Like,
little bit more of a clean, I wanted more clean work, and definitely an environment where you don't get hit with aldehyde early in the morning. And I also had a friend who was a chiropractor too, and shadowed him for a little bit, and yeah, it felt more in alignment with what I wanted to do. But the whole journey really began. It actually began with my childhood. I was a very, very curious person. I remember my mom told me this story where she had bought a keychain from, I believe, Switzerland. I could be wrong, but from Switzerland. And anytime you whistled at the keychain, it would record your voice and it will whistle back. So you could find your key, right? And me at the age of 2, I was like, who's doing that? So here I am with like a little hammer, like hitting the keychain, trying to break it and see what's inside. So that curiosity has always been there. And when I graduated, with any of the chiropractors that graduate, they get all the basic information that you need to have a nice stepping stone for yourself to grow, right? And when I went to Iran, that I think was a insane experience for a few different reasons. Number one, you get a lot of patients coming to you and dumping all of their problems onto you. So they've got blood pressure issues, they've got, cholesterol, they have Parkinson, like they just, and it's a whole mental, physical, sometimes even spiritual issues that they're just like, I have this issue, that issue, and they want you to fix it all, right?
So they give you the
And
full rundown.
exactly. And for me, I wanted to be able to help them, right? I wanted to make sure that they were taken care of, whether it was physically, mentally, spiritually. I wanted to be able to see them as a person who's got thoughts, who's got ideas, who has stress, who has anxiety. And then, they have kidney stones that is causing them lower back pain. They have disc and stenosis and arthritis that's causing them neck pain, hip pain, knee, like shoulder pain, everything. So, I started to treat my patients in a very unique way. And I learned my way of treatment from an internship that I did in LA. I was part of what is now known as Rehab LA, where they focus a lot on athletes. So they complement the chiropractic treatment with a lot of corrective exercises and also using physiotherapy modalities like EMS, ultrasound, laser, shockwave. So I implemented that into my treatments when I was treating patients in Iran. uh, yeah, and couple of years later, I started to experience some numbness tingling into my pinky toe, and sure enough, at the time I was like, "Oh, I'm having some either sciatica or I'm having some sort of a disc problem." And it's quite easy to actually do imaging in Iran, so I went to a medical imaging center, and sure enough, I had a L5 S1 disc bulge that was compressing on the nerve a little bit. So that really is where I took a step back and rethought the entire process, because I was like, I've been getting adjusted since chiropractic school. I've been getting adjusted after chiropractic school. So how is it that now I have a disc? And if I'm supposed to heal my patients with a disc, then what's going on with me? Why do I have a disc? And that's kind of where everything kind of started.
I feel like the origin stories for most people when they build their own business, they're like, it was something that happened to them. They're like, "This can't be the thing that I'm teaching or I'm doing, and now it's happening to me." So that I didn't know that. That was cool. How did that transpire into you? Did you take any time off, or did you go right back into, like, just accumulating knowledge to, like, solve the problem for yourself and then be able to
Yeah,
solve it?
good question. So what I ended up doing at the time, I was very healthy. I was constantly exercising, eating pretty decent foods, and you know, I looked after my health. So it was such a difficult pill to swallow,
Mhm.
because I'm like, I'm doing cardio, I'm lifting weights, I'm eating, relatively speaking, healthy. I would probably say maybe 80% of my diet was healthy foods, and then maybe 20% I had some not so healthy foods. But I was doing pretty good. So for me, I was like, okay, I got to take a step back and figure out exactly what's going on. And I've endured a lot of injuries, which I've also shared on my Instagram as, like a about me section, or a about me highlight. I've had a lot of injuries since I was born. It involved my hip, my ankle, my knee, my wrist, like literally every single every
Everything
single body part that exists, I've either broken or I've torn or I've sprained or something. So
that makes you a good tester for all of the things you do. It's like, "I've experienced this."
exactly, and I think that's so important, because when a patient comes in and tells me that they are experiencing knee pain from a tear, from an ACL tear or a meniscus tear, I've actually endured the pain.
Mhm.
So I'm very familiar with the quality of pain that they're experiencing, with the intensity, what is limited for them, and what they can do, what they cannot do. So it allows me to be very sympathetic with my patients, which I'm super blessed for that. And I think after a long time, I started to recognize that all of those injuries were a blessing in my career, because I'm able to, yeah, I'm able to understand. Somebody tells me like they have they have a disc bulge and, they have some low back pain because of it. I'm like, yep, I know exactly what that feels like. So that's it. Yeah, it's great. But it also taught me a lot too, because for me personally, when I started to dive inward to understand why the disc started to show itself in my body, what happened with my biomechanics, what happened with my back, what happened with my hips. And when I was in martial arts long time ago as a youth, I remember my sensei was always telling me, like, you got a very stiff body. And he didn't have to tell me. I knew I had a very stiff body because everybody in class was able to, like, do the splits, and I was so far away. And one of my first injuries was my hip pain, which the pediatrician was doing the ortolani test, which is a very routine movement for the hips. It opens up the hips in the babies. And when he did this to my hip, they either snapped something or they broke something, but they had a distinct popping sound in my hip, and they wanted to do surgery. At the time, my mom had lost her firstborn, so surgery was a big no-no for my mom. So she went to a few different pediatricians, and they ended up telling her, massage his leg into Epsom salt bath. And if he ends up walking normally, then you don't have to do surgery. So I think stiffness in my hip has always been there because of that. So at the time where I started to experience my disc, I was like, I'm going to take a step back and I'm going to start working on my hips, because that's where my first injury was. So, started doing some stretches, some muscle activations, trying to get my muscles to work and trying to understand what muscles do exactly what. Literally I downloaded this app where it showed the muscles and it showed the origin, the insertions, and you can really visualize if the muscle is contracting, what is the action upon the joints. And I started to just kind of explore within my body and being able to create very isolated contraction in each of my muscles and trying to understand what each muscle does and what joints does it move and how far can I push it, and so on and so forth. And that started to create a healing process for me. And when I implemented that within my patient, so if I saw a biomechanical dysfunction in my patient, and I was like, you got to strengthen this muscle. You got to make sure when you're moving your shoulder or your back or your neck, you have to make sure the sequence of activation in the muscles is happening from the most superficial muscles to the most deepest layer of the muscles. And when I did this, my patients start to heal a lot faster than what I was typically accustomed to.
That's cool, 'cause if I recall, those were I used to watch some of the videos that you had on, like, just different modalities and different things to move my body in ways that I hadn't, 'cause I spend majority of my time on a keyboard, and I spend my time driving with my right hand, so, like, everything from this side is just, like, that's the muscle that's being used, and so I remember having to getting to watch some of your content, and I think it's really cool because you mentioned the fact that you obviously, like, this is your passion, like, you get to do the things that you love because you've had the deep experience, but your ability to, as a business owner, to make content and make useful resources for your patients is, like, next level. Like, by the time I knew you, you had hundreds of videos and stuff that I could actually watch, and it was super helpful for me to be able to go through those and then obviously hear what you had to say in person. How did you end up in that world of content? Like, what made you decide that content was a big factor in your business in order to help your patients?
So I believed that healing should be for everyone. And I don't believe that people should pay to understand their own body. Yeah. I think people deserve to know the very basic information about their own body. How many muscles I have, maybe even the names of the muscles, at the very least, to know what each muscle is supposed to do. Qualities of pain, being able to understand your own pain. A lot of times we fear pain, right? So if you are, and we always fear what we do not understand. So if you know that, okay, I'm just experiencing muscle pain, and I can easily address this muscle pain, then it takes a little bit of that worry away. Even understanding joint pain as well. I believe you have to understand just your own body. Like if you have a laptop or a phone, you want to know what the functions of your phone would be, what the functions of your laptop would be, so you can utilize your phone or your laptop or whatever equipment you have to its fullest. Right? The body isn't any different. I think you need to truly understand your own body because you get to live in it for
Your
you
whole
know
life.
yeah, yeah, your entire life, right? And so I think that was the goal behind starting the social media. I don't remember exactly when I started my Instagram. I think maybe 2015 is when I started my first post. I could be wrong. uh, and I just began with just posting a few pictures, and then at some point I was like, oh, okay, maybe it's a good idea for me to give patients like home remedies, like how to roll your quads or how to roll your hamstrings, or like how to apply ice and heat, because a lot of people will think that it's only one way to apply cold or heat, but there's actually multiple ways that you could do that, right?
Right,
So
it's
I
like they
just started to
see one
yeah,
way.
I just started to, give out these little home remedies, and then it turned into like giving out some stretches, some strengthening exercises, and then I showcased my adjustments for patients, for people who have, let's say, sciatica issues. What kind of adjustments will help with sciatica? What kind of adjustments will help with kyphosis, scoliosis, right? So these are some of the things that was in the background. And I don't think I thought about it from the get-go. From the get-go, I think I was like, I'm just gonna post a little picture of, you know, what is chiropractic? What does it do for you? So
It's
it just kind of started it from there, and here we are.
here you are with the what is it, like, over 100,000 followers or something? Something
Yeah, yeah. It's crazy. I can't even hear that. That's insane.
that's pretty amazing. I love it. I love to see all
Thank
the
you.
videos. The format that you have now is it's honestly super fun to watch, all the back popping, but when it co I the fact that you said healing should be for everyone, that stood out to me, like, healing should be for everyone, and as a chiropractor, how do you in your line of work, how do you make that happen? I wrote down 2 things, healing should be for everyone, and we fear what we don't understand. So, how do you help people a little bit more once they come into your office? Like, what's the experience somebody can expect when they come into your office in LA, and do you only do the ring dinger, or do you do multiple different things? Like, what's the practice that you guys do now?
So thank you for asking that. I think that's such a good question. When I found out about my problems and how deep and rooted the issues were, I wanted to implement that into my practice. So I think the first step is to be able to have ears to listen to what the patient has going on. Like I have a lot of patients that come in, they're like, I have neck pain or I have back pain or I have shoulder, like whatever. And then I start to ask them specific questions, and I'm like, tell me if you've had any issues in your ankles, even when you were like a little kid, right? Did you ever sprain your ankle? Like I want a whole picture. I want to know your entire story. Every single fall, every single injury, every single accident. And then, sometimes I have patients that open up about, personal traumas, which I think play a huge role into physical pain, because you can absolutely have psychological issues that manifest itself into the physical form. So I think listening is the biggest aspect of being able to initiate healing.
Mhm.
So when a patient comes in, we do obviously a full history, we do a full comprehensive exam from head to toe. So it's not just addressing the neck. We address the spine, the upper extremities, the lower extremities, and if they are a good candidate to get their spine decompressed through the ring dinger technique, and that is definitely a treatment that we do offer, and we do go through a full body adjustment. Yeah, going back to how we started this conversation, the body works as one unit from head to toe. So you can address the low back, but if you don't address the ankles, your problem will come back again. Especially like the feet is probably the most important part of the human body, which is hilarious because my sister always makes fun of me because it's like you have this obsession with feet. I'm like, I swear I don't.
So, like, it's sort of the process.
It's so I went barefoot roughly about, I think, beginning of COVID is when I started to experiment with barefoot shoes and the five fingers. I don't know if you recall me ever wearing my five finger shoes in the office, but I've been barefoot for the past 5 years, almost coming up to six. And I understood how one tiny muscle on my feet not being able to work, it started to affect the chain into my lower extremity. Like my feet didn't work, and then it progressed into my calves, it progressed into my hamstrings, and it eventually worked its way up into my spine. So, it's super, super important to address the entire body and not just the problem area. Yeah, the feet is super, super important. I went barefoot early COVID. So I think
The
right in
barefoot shoes
2020.
or just, like, straight up
Yeah.
barefoot shoes?
Yeah, no, no, barefoot shoes, and I don't know if you remember or not, but I always wore my five finger the toe
Yep,
shoes.
yep.
So it's super important to address the whole body. That's kind of what we were going for. You have to address the whole body, and you can't just say, okay, well, if you have low back pain, let me adjust your low back only, and then let's not address the foot, the knee, the ankles, you know, the hips. And I specifically remembered that when I had an issue in my left toe, how that started to affect the chain of command. It started to go into my calves, into my hamstrings, into my lower back, and it eventually worked its way up all the way into my neck as well. Because everything, yeah, everything works together. So, we're on our feet all the time, right? You have to look at the body as one unit and be able to address every little issue at each individual session. And I think that's where most patients will truly feel a change. I don't want to say healing because healing is something that does take time, but they come in for that first session and they're like, you know what? After they leave, they're like, okay, I actually feel a little different. Right. And I think that's the goal when it comes to healing.
That is really cool. The talk to us a little bit about the actual technique of, because I know there's many multiple different techniques that chiropractors get into. How did you end up studying the ring dinger and making that part of your practice?
I was a patient. I was
You're
a patient of Ringdinger. Yeah. I had so Dr. Ali Elahi, shout out to him. I was constantly looking at his videos, and I just remembered I was like, man, I could just feel my spine needs to open up like that. And I was experiencing some right-sided hip pain, and that's my first injury. So it was so hard for me to like cross my right leg over my left leg. And I remember going to Dr. Johnson's office and I said, I need to get the ring dinger done. If it works, I want to be able to learn it and give it to my patients as well. So, here I am, he did the adjustment for me and then we went back to his office to talk. I had crossed my right leg over my left leg without even thinking about it.
oh,
Right. So, and he just like look at your leg. And I was like, snap. Yeah, look at that. Right. So it was such an immediate result. And I was just in awe. I was like, okay, yeah, I definitely want to learn this and I want to be able to give this to my patients. And I've been doing decompression, like different methods of decompression. This by far will give you the most sensation of getting decompressed. Like, so you have inversion tables, you have the Y strap, you have the machines that do decompression for you. You have some weights and pulley system that you can use at home to give you decompression. But this was by far the best method. Like with the inversion table, even if you can handle getting inverted for a few minutes, you have such a rush of blood going into your head that it just becomes uncomfortable after a few minutes. So you don't want to, you pull your body back up. And it's hard to actually decompress your entire spine. You literally will need some actual decent force to be able to pull the vertebrae away from each other. And it's so sad too, because a lot of people think that your spine is so fragile. Like I
Really?
I mean, yeah, I can't express enough like how resilient the spine is. I mean, I see some of these comments under my videos and I'm like, if you only knew how strong your spine is and how strong your ligaments are and how much endurance they have, you would not even think twice about getting this done, or you would not be so afraid of it.
That's
Now,
what I was
many
gonna
people,
ask. It's like for the individual that's afraid of chiropractic or afraid of getting popped, or why are people afraid of getting popped or hearing the sound? Is it just like what where does that fear come from? Because everything in my experience, I'm like, I do this stuff to help my body. And so I've never understood the fear side of it. But I know so many people are fearful of it.
yeah, I think, I mean, I don't know where the fear is coming from, but I feel, or at least from what I hear, it's misinformation.
Mhm.
I think is a big aspect of this, the fear. I get this a lot under my comments is like, that's a really nice way to dissect your arteries. And I'm like, yeah, I mean, listen, there's a risk involved with anything in life. Like even driving a car, you go out on a street, there's a chance that you could get into an accident and die. God forbid. But there's a chance for that happening. But you're not going to make yourself homebound just because there's a risk that this could happen. Quite frankly, if you're very careful and you're a good driver, you can probably avoid a lot of these accidents. And also, I think I could be wrong on this, but I think there was a study done, and it proved that majority of the accidents that happen is because of the drivers being distracted or they're not aware, right? So if you're focused, if you're driving by the laws, and you're not speeding or you're not going too slow, like you're probably going to be fine. And so the same thing will apply. If you go to a doctor who's going to do their due diligence, do the proper examination, do a full history taking, and then make sure you're safe for their procedure, you're probably going to be doing just fine. Now, on from my end, I have heard some stories where it raises my eyebrows. Like I've had some people who are like, "Yeah, I met this chiropractor that just adjusted me when we were at this party, and I just told him that I have some neck pain, and he didn't. He's like, come check this out, and he cracked my neck, and boom, that was it." I'm like, so those are the people who
Yeah.
are probably causing some of these injuries, and that's probably where these stories are coming from, which is kind of sad because you got to make sure you're asking some proper questions. You got to make sure you're doing a physical examination. You have to explain the patient what they're about to experience, not just give them this shock. And a lot of times when you do adjust patients, there's a soreness that's associated with it, right? You go to the gym, you lift weights. If you did a good exercise, you're gonna have some good soreness the next couple of days. And the same thing will apply with chiropractic. I see this quote a lot. So movement is medicine.
Mhm.
When we talk about movement is medicine, there are different categories of movement. You have muscles that move your joints, and then you have ligaments that articulate your joints as well. So you can obviously move your joints by contracting and relaxing some of your muscles. But the ligaments, they need a little bit of an extra force, right? So my sister was telling me, she's like, I sprained my right ankle, and I have more mobility in the ankle that I sprained compared to the one that I didn't sprain. So this kind of, I was like, well, that's interesting, because as a chiropractor, that's kind of what we're doing, is just not as intense as a sprain, right? So we are trying to stretch out a ligamentous tissue, which is a semi-hard tissue, and it covers every single joint in the body, right? You have ligaments that cover every single joint in the body. So we are trying to stretch out these ligamentous tissue to improve range of motion, bring a bit more functionality to your body. So I don't understand where the fear is coming from. And it is good for you, honestly. Like when you get adjusted, you feel a lot lighter. You feel, yeah, you feel good. Your body can move now, you know? And it's like you take your car for an oil change, right? Every 3, 4, 5,000 miles, whatever, however the oil is, and what depending to your car. The adjustment that we do, I relate it back to that, right? It's like a little oil change for these joints because these joints are covered in a capsule and there's fluid inside the capsule. And so when we start to pull these joints into a position where they're super compacted, you have a gas that exits the joint. And when a gas exits the joint capsule, that changes the internal pressure in that joint capsule. And the change in pressure will cause the fluids inside of them to be a little bit more mobile. So, I think an orthopedic surgeon like cracked his knuckles for 40 years in one hand and ended up doing an x-ray of both of his hands to show that cracking your knuckles is
He only
not a
did it
bad thing.
he only did it in one hand, right?
Yeah, yeah, so he cracked his knuckles in one hand and he didn't crack the other hand, and he ended up doing an x-ray study on both of his hands, and there was no issues with the hands that he ended up cracking. I don't know if this is correct or not. Somebody can fact check this, but I do believe that he said that the hand that he ended up popping more, it was a lot more fluid when it came into his movement. But I could be wrong on that, so don't quote me on it.
Somebody can do the fact checking. Somebody will.
Yeah,
That's really cool. I think one of the questions I had while I was listening to you is like, obviously there's a risk involved. Is there an actual percentage per, that doctors know or that chiropractors know? Like, there's a percentage that they tell their patients
it's
that's
one out of a 1 to 2 million adjustments.
as like it
Yeah,
has to be so minuscule.
yeah. I think you have a higher chance of getting struck by lightning than to actually getting injured from a chiropractic standpoint. And I think, again, it comes down to doing due diligence, making sure you have proper history taking, making sure you do proper examination, and then understanding the risk and reward. There's been patients who I've turned away, and I don't adjust them. Or if chiropractic is not the best option for them, I might tell them you need to do some corrective exercises. So I offer them a different modality for healing. But yeah, then not everybody is a good candidate for chiropractic, and that's okay. Absolutely.
Sweet. I think the biggest question that most of the people that I'm around are always asking is like, I fear chiropractic. They think it's scary.
What you seek is on the other side of fear. That's one of my favorite quotes.
What you seek is on the other side of fear. Wow.
Yeah.
When it comes to your practice overall, like you've mentioned a few little like one-liners as almost like your kind of philosophy on healing. Do you have any other major philosophies on healing that you kind of live by?
That's a very good question. I have to think about that one. One of them for sure is you have to look within. There's nothing in this world that is going to give you true healing, especially if it's passive. Massage, chiropractic, physical therapy, injections, medication, none of that is ever going to bring you true healing. I think true healing comes in with you understanding what the problem is, understanding what kind of nutrition your body requires, getting enough sunlight, spending time in nature, making sure you're mentally clear, giving your body the proper movement your body actually needs, right? So all of those, because you have to, it's a neurology that you have to train. I give this example a lot to my patients. Think of your handwriting, right? When you were in first grade, how difficult was for somebody to have decent handwriting? It was pretty difficult, right? But you didn't give up. So you started to scribble A, B, C, and you started to do pages of that. I mean, maybe nowadays where everything is becoming a bit more digitalized, I don't know if people in elementary schools are writing much, but that's how That's how your handwriting started to develop. And over, 3 years, 5 years, 6 years, you started to have a decent handwriting. So you started to train the neurology, you trained the muscles to do fine motor skills. Eventually, you're going to have a good handwriting. So if you are, for example, I see this a lot. So a lot of people will complain about this upper shoulder neck pain, right? And I see them as soon as I'm like, lift your arm up, what I see is their upper traps and shoulders contract, and then they lift the hand up. So the way that the nerves are sending the information to the muscles are in such a way that you have this muscle that's not supposed to be working, it's working, right? So imagine you're constantly doing somebody else's work. At some point you're gonna be like, you know what?
You're like, "I'm tired."
Screw this. Yeah, screw this. I'm off. I'm not working anymore. So that's kind of your body telling you, enough is enough. Like, I'm done. I don't want to do this anymore. So it just sends you that pain signal to bring some awareness, and so you can give some attention to whichever part of the body that's in pain. So yeah, you have to develop that neurology in order to create healing. I can adjust the neck and the shoulder. You can go get a massage on that particular muscle. You can get some PT modalities on it. But if you do not train that neurology, it's going to come back. Yeah. But yeah, I don't know of any quotes. I truly think that
No,
healing
that was
happens from
perfect.
within. Good.
Like, I wanted to hear, like, the inside of, like, how you think about all of it, which is cool because you don't get to see that. I get to see, like, back cracking videos, but I'm like, there's a person behind this practice. There's a person behind the whole ins and outs of running this thing, and so that's my favorite type of conversation is to be able to hear like the ins and outs of how you got to where you got to and um build what you build, but also it's like you get to see a lot, you get to see people at their best and at their worst after you. How does that play into an effect on your life as a chiropractor? Like, do you have to like I'm sure seeing people at their worst and then healing them or helping them heal their bodies has a really cool effect, but like what do you do on the days that it's sucky, like, crappy?
He had a hard time with this, honestly, because there was definitely a point in time where I was struggling personally as well. And it was very hard for me to show up to work. And I was like, I don't want to deal with no negative energy, people telling me that they're in pain, this and this and that, and they're not willing to put in the work. But I found out that people, first of all, we have to show up for each other. I think that's super important. I don't want to be just my patient's chiropractor. I want to be their friend. I want them to feel comfortable enough for them to share their issues, right? I want to be able to have call it an open door policy or whatever, but I want them to feel so safe and so cared for that they're able to share with me all of their information, all the things that bother them, right? And so I started to have this approach that you gotta treat everybody with kindness. You gotta be friends with everybody. You have to make sure that they understand that you're coming from a loving point, or loving space. And that was a game changer for me. And even if some patients who are in pain, I try to understand that they just need some loving, some caring. They need some attention, and you got to give it to them. And honestly, as doctors, that's, I think, the most important thing for sure. I feel like you got to put everything aside. You got to be very kind, and you got to be very accepting, and you got to be very inviting. And that's the cost of being a good doctor. Because if you cannot do that, and if you're going to have an attitude, why did so and so didn't show up, or why did they show up late, or why are they telling me this, or why did it, like, it just creates such a negative environment that people can definitely feel that, and no healing is ever going to come from that environment.
Fair enough, fair enough. Well, this was a great conversation. I hope that everybody who watches this gets to like, obviously learn more about what it is that you do, and can you tell people where they can find you as far as, like, the actual location, and then where can they find you on social media? Like, how can they stay in touch with you?
Yeah, absolutely. So I am here out in California, Los Angeles, in Santa Monica specifically. The website is probably the best place to get all of my information, the address, the phone number. It's www.witnesschiropractic.com. And for those who don't know, Shahed in Farsi means witness. So that's kind of how I came up with the name. And then my social media, same. It's Witness Chiropractic. I'm on TikTok. I'm on YouTube. I'm on Instagram. I'm on LinkedIn. I'm on Facebook. I try to get them all.
I lo
So yeah,
love it a lot.
this was fun. This was really, really good. I
I
really
was
appreciate you for inviting me. Yeah, thank you.
Thank you for spending your time. I really appreciate it. You were talking about how your clients become friends and more than just, like, being a doctor, and I was like, ever since I met you, I was like, I had this perception of doctors and chiropractors, and you just shattered it, and I was like, "This is the coolest thing ever," like, so I
Awesome. Yeah.
really appreciate everything that you've done for me to heal my body, and I'm just I can't wait to come out to LA and see you.
You got to.
I'm actually coming. I have a friend that out there, and I can't wait to come, so I might have and she's actually in Santa Monica, so,
That's
uh,
perfect.
I was like, "I gotta
Yeah,
stop by,
you gotta come give the ringing a try for sure.
will do." But
We'll we'll pull your spine straight.
make it straight, we'll make it as straight as possible,
There you go.
but this was amazing. Thank you so much for your insight. Thank you for your dedication to your craft. Like, it's special and it's rare, and I don't think that many people really take hold of the fact that, like, this not that it is your life, but it is part of your life, and you have to sacrifice certain things in order to get certain things, and it is really evident that you love what you do and who you get to help and how you get to go about helping them. And so thank you for adding so much value to the world and bringing your expertise and your obsession to so many different people.
That's so nice. I mean, this it's a true blessing. I'm the one who feels, like, blessed. Thank you for recognizing all of this. Thanks to all my patients for recognizing all that. Yeah, it's a true blessing. I wanna be able to help. I wanna be able to do everything I possibly can for everybody who's in pain and who wants to find healing. So it's a true blessing for me.
Amazing. Well, thank you so much.
Yeah. Thanks, Grace. It was good to see you.
Good to see you.
All right. Take